Invia Wound Therapy from Medela Healthcare, the negative pressure wound therapy system from the Name Hospitals Trust. Open the box that you have received from Medela. Save carton for easy return once the therapy has been discontinued. Inspect all parts to ensure completeness and that damage has not occurred. When you receive your Invia Vario pump, you will need to completely discharge and recharge the battery. This can be done by turning on the pump and letting it run until it stops. Once the pump stops, plug the pump into an electrical outlet. It will take 5 hours for the pump to fully recharge. You can still use your Invia Vario pump while it is recharging. Once the pump is fully charged, this will allow the patient to disconnect from the power source for 30 to 45 minute intervals if needed. Slide the blue adapter ring into the slot in front of the pump. There are 2 grooves in this slot. The first groove will allow placement of the 800 milliliter canister, and the second will allow for the 1200 milliliter canister without accidental detachment or slippage of the unit. Place the 1200 milliliter canister on a steady surface. The solidifier packets allow the drainage to convert into a gel for easy disposal. Place the unopened solidifier packets into the canister and secure the lid on top. Close the drainage port and the tandem port. Place the canister inside the blue adapter ring. Insert the square filter into the hole on top of the pump. For removal, turning the filter in a counterclockwise fashion will reduce the possibility of breaking the filter within the pump. You should have received silicone tubing with a coupling piece on each end. This is universal silicone tubing that allows for use with any of our canisters. Remove the straight coupling from one end of the tubing. Attach one end of the tubing to the filter and the other to the suction port on the canister. You will need to remove the suction extension tubing from the Invia Wound Therapy set. Attach the suction tubing from the Invia Wound Therapy set to the patient port on the canister. Perform an operational check to determine that the pump is functioning properly before placing on the patient. Seal the end of the suction tubing off with your thumb. Turn the pump on by placing in the constant mode. Depress the suction knob and dial the desired suction level of 60 to 80 millimeters of mercury noted on the red numbers on the dial. Medela recommends vacuum levels set between 60 and 80 millimeters of mercury. Once the desired vacuum level is achieved, the pump is operational. Wound measurements should be taken with consistency and accuracy. Accurate measurement of the wound is crucial for wound management and reimbursement. This can also be valuable for early detection of changes in a patient's condition. Wounds should be measured in centimeters. Wounds should be measured at least weekly or according to facility guidelines. For width, you should measure from wound edge to wound edge as shown here. For length, you would measure again from wound edge to wound edge as shown here. Lastly, depth. This will require a cotton tip applicator. Place the applicator to the deepest part of the wound. Now take this area and place along a ruler. Note all 3 dimensions with each measurement. If you would have undermining, tunnels, or tracks within a wound, these would be measured separately. The pump has been set up as instructed. Check the suction to ensure satisfactory function of the equipment. We will now begin by using the Invia Wound Therapy Tier 1 set. Remove all contents of the set, making sure you have all required supplies. Prepare the wound. Cleanse the wound as directed, or use normal saline to cleanse and irrigate your wound. Pat dry with gauze pad. Prepare skin by using the no-sting barrier. This will allow adequate time for drying while you dress the wound. Remove the non-adherent contact layer and cut so it mimics the wound but does not track onto the peri-wound area. The non-adherent wound contact layer should fit within the wound borders. This layer is designed to minimize disruption of granulation tissue and reduce discomfort during dressing changes. This also allows for even distribution of suction throughout the wound bed. Next, take the antimicrobial gauze and moisten with saline. Wring out excess saline so the gauze is moist, but there is not excessive amounts, which could cause the dressing not to adhere properly or maceration to the peri-wound area. Cut the gauze so you have a single gauze layer in the wound bed on top of the non-adherent layer. Remove the flat drain. Measure the drain so it is placed within the wound borders. This can be accomplished by cutting the drain so it is closest to the middle of the wound. This allows for slight movement without touching the wound walls. Place the drain on top of the antimicrobial gauze layer. Fill the remaining depth of the wound with moistened antimicrobial gauze. Fill with gauze until it becomes flush to skin level. Be careful not to overpack. Seal the system with the transparent dressing. Remove the window from the picture frame. This will allow you to view the wound while you are sealing the wound. Start at the opposite end of the drain. Gently walk the dressing down until you get to the tubing. Slightly raise and pinch to seal from leaks. Attach drain tubing to the Christmas tree connector. Turn on machine to constant suction that has already been set. Look and listen. You should see the dressing collapse if a proper seal has been made. If you do not have an adequate seal, you will need to patch any leaks with the excess transparent dressing until you see the dressing collapse. You should also listen to make sure you do not hear any leaks in your seal. Monitor that the appropriate suction level has been achieved and maintained. Use the white tape and secure the drain to prevent accidental removal of the system. Be careful not to place the drain tubing over any bony prominences or places that the skin is fragile. Rotate the position of the drain tubing with each dressing change to decrease the potential of tissue damage to the area directly under the drain tubing. If the peri-wound area is fragile, you may need to protect with a layer of transparent dressing or a hydrocolate type dressing. Dressing changes are recommended every 48 hours unless otherwise directed by the prescribing clinician. See troubleshooting instructions if technical problems arise. Contact Medela or visit www.medela.com for product availability in your area. For assistance with product operation, contact Medela Customer Support or refer to the Instructions for Use manual. 877-MY-INVIA. This product is not available in all countries. Visit www.medela.com to learn more about international distribution.